Welcome back to movementprofessional.com. So this video is an explanation and demonstration of the setup for the Brettzel. So what we're going to do first is look at what position that we want to get into so that we can really stabilize and try to get the movement from the joints that we're trying to get it from. So predominantly we're looking to get hip extension on the bottom side leg, and then we're trying to get some thoracic rotation up top. So the setup for the Brettzel would be, you're going to start on your side. What I like to do is I like to grab this bottom ankle. So I can even start in a seated position. So we'll do, starting on my right hip, I'm going to grab my right ankle with my left hand. So then I'm going to lie on my side. So first setup point here is going to be, I want to keep this outer edge of the foot on the ground. So I got that outer edge of the foot on the ground. That's going to move this knee up. That's fine for now. All right, then I want to try to get this bottom knee, this right knee, in line with my hip. And then I'm going to try to adjust and get my knee in such a situation, or this top knee in such a situation where my top hip is stacked over my bottom hip. So stacked can be, you can think of it as a vertical plane on from the pelvis down to the ground. Or we can just think about this top greater trochanter over the bottom greater trochanter. So once I get this position, I get these hand holds, I'm going to try to put the back of my head on the ground, and now I'm going to breathe from here. All right, so once I get this set up, I can truly be trying and attempting to get hip extension on this bottom leg, and then I'm going to try to get the back of my left shoulder closer to the ground. So now the breathing comes into play here. So every time I inhale, I want to think about kicking my right hand or my right foot into my left hand, and creating a sense of reaching my right hip out of the socket, and then I want to reach my left hip out of the socket while I'm trying to put the inside of my top foot, my left foot here, on the ground. All right, then when I exhale, I want to pull my belly button to my spine. I want to think about bringing my rib cage down, and I'm going to try to feel that compression in the middle go to my inner thighs and create a feeling of inner thigh activity, which will help to promote more hip extension. All right, and then the next inhale, I'll do the same thing. So inhale, reach, and then as I inhale, I want to see if I can bring some air or some expansion to the space between my shoulder blades and allow that to help me get a little bit more rotation where I get the back of my left shoulder, not my left shoulder blade, but the space between the shoulder blade and the thoracic spine closer to the ground. Exhale, belly button to spine. Pull my abs in, pull my pelvic floor up, see if I can feel my inner thighs. I might get a little bit of bleed into the lats or the space under the armpit just as an anchor here to give myself a little bit more rotation. And then the next inhale, I get a little bit more reach, and it should be easier for me to get this foot down, which it is now. And then exhale, squeeze, a little bit more rotation. All right, so I want to be able to spend at least 2 minutes there. So if that position would be too hard, then we can use some type of prop. So we can use a strap for the foot, we can use a block for the knee, so I'll demonstrate that. So we'll discuss 3 different props that we can use to make this setup position a little bit more attainable. So if we're having a hard time just anchoring this bottom foot with the hand, then we're going to use a strap. The stretch out strap works perfectly because it has little loops that we can get progressively closer to our foot. So let's say that I have a hard time grabbing my ankle. I'm going to just take my hand now and I'm going to loop it to the loop that's right next to the one that's by my foot. And that'll give me a little bit of space for me to get myself into position here. Okay, so instead of grabbing the ankle, now I just grab the loop and I'm able to more easily get my leg into position. All right, and then this hand can still get on the top leg and I can get myself into position. So now I don't have to work as hard to reach down and grab my ankle, and I can still go through the breathing cycle here. All right, so now let's say this knee, it's uncomfortable having it hover here. I don't feel like I can get the idea of externally rotating the hip and getting the foot closer to the ground, and I just want a little bit more of an anchor. So that's where we use a yoga block. So we can use this in 3 different angles. So the first one would be up here, the highest position. So I have an anchor with the strap. I got my knee resting, but I don't want to push this knee in there so much. I just have an anchor there for me to feel like I'm a little bit more stable so I can focus on my breathing a little bit more. And it makes it easier for me to spend 2 minutes in the position. I can also just start with this anchor here, the block at this position with my hand on this loop, and then every breath I might be able to get a little bit closer to my ankle on the bottom hand, and I might be able to turn this block down so I get my knee a little bit closer to the ground. So the goal here, I would say, is to get to the point where you can rest your knee gently on the block with the flattest angle, still be able to keep the outer edge of the right foot, and then be able to breathe. And with every exhale, or with every breath, you're able to get a little bit closer to the inside of the top foot gets down while keeping the outside of the bottom foot down. All right, and then being able to anchor to the ankle, not need the strap. The other area where you might need a little bit of a prop is for your head. So let's say you can grab the ankle, you're pretty comfortable with where you are with the top hand, but your head is hanging out and it can't touch the ground, or you really have to reach and poke your chin to touch the ground. So then you can use a block, or I like the ab mat to just get started so that becomes more comfortable. Because comfort is important here. Your setup will be the most important part of this, because if you are in an uncomfortable setup position, you're going to be straining the whole time. You need to be able to be comfortable here so that you can breathe here, because the breath is what moves you. The inhale is going to move the rib cage, which moves the thoracic spine. The exhale is going to be able to compress the abs, compress the hips in the way that we want to direct them. So if you're not able to be comfortable, then you're not going to be able to get what you're looking for out of the mobility corrective. Hopefully that makes sense. If you have any questions, please comment below, or you can go to movementprofessional.com. I'll see you next time.